I'm Dr. Ron Hugate with Panorama Orthopedics, and this is a video about how to recover from a Ganz procedure and what to expect. You're admitted afterwards with a hospital stay of about 3 to 4 days. There's a few things that happen during your hospital stay recovery. One is in the initial day after surgery, you have what's called a spinal. It helps with pain control and keeps you numb basically from the waist down. So in the beginning, first day and even into the second day, your legs are a bit weak. You can't really do much in the way of walking, and we have you just hanging out and getting better after the surgery. Once the spinal wears off, then we try to start pretty quickly getting patients up, moving them around. Patients that move around quicker after surgery tend to do better. Less blood clots, bed sores, pneumonia, things like that. So we try really on post-operative day 1, if we can, to get people up and moving around the hospital with the physical therapist. We're using crutches in the beginning. Crutches are necessary to keep weight off the leg for about 6 weeks after this surgery. So we let people put their foot on the floor, but not put weight through their foot. And they're taught how to do that by the physical therapist in the hospital. Pain control with the spinal, and then oral and IV pain medications if necessary. And then eventually on post-operative day 3 or 4, usually people tend to head home at that point. So once you leave the hospital, you're on crutches. We usually have patients see their therapist about once a week in the first 6 weeks because we don't have them doing any weight bearing or strengthening. Really, we just want them to be moving their hip around, making sure they don't get too stiff. Dr. Ellman and I have developed a phased physical therapy program, and this is the first phase of the program. Passive range of motion. The therapist helps to move your hip around and keep you from getting too stiff. Also, Dr. Ellman has patients in a continuous passive motion machine to help move the hip even when they're not with the therapist. Patients will have pain medications at home to be used as needed. We usually see them back at about 2 weeks after the surgery to do a follow-up. We usually get x-rays. If there are sutures, we'll take out sutures at that time. Sometimes we use absorbable sutures that don't need to be taken out, but we'll do a wound check at that point. And then we see patients back usually at the 6-week mark for their second visit after the surgery. And at that point, we look for healing. If there's enough healing at that point, and there usually is, then we let people start weight bearing fully then. It takes, though, about 6 months to a year for a full recovery from this operation. A lot of patients have questions about driving, and driving is depending on a couple things. Number one, you have to be full weight bearing on your driving extremity. So if you drive an automatic, for example, you have to be able to fully weight bear on your right leg. So for patients that have a Ganz procedure on their right side, that usually takes 6 weeks before we can let you fully weight bear. If you've had a Ganz on the left side, of course, that's not an issue. But the second half of this equation is you have to be off of pain medications. So I would say for patients that have a Ganz procedure on the left side, that you're usually on pain meds for about 2 weeks. So at 2 weeks you can start to drive yourself. However, again, if you've had the Ganz procedure on the right side, you have to be full weight bearing and off pain meds, and that usually occurs, the full weight bearing is at 6 weeks. And I think a general rule of thumb is when I clear you to drive, or clear our patients to drive, I like patients to go into an empty parking lot with their car, apply the brakes in a hurry, make sure that they can move their feet around and use force if necessary, just in case the need arises. It's a common question that we get about childbirthing because people with dysplasia more commonly are females, and we usually see young females. And so it's a really legitimate concern that patients may have. The good news is when we do this operation, we really don't change the shape or the size of the birthing canal at all. The way we do the procedure, we're always outside the inner part of the pelvis. And so studies have been done on this, and having a Ganz procedure really doesn't affect your ability to have children in a natural fashion whatsoever. The risks associated with the Ganz procedure start out with bleeding. There is some bleeding with the procedure, and we're doing the 2 procedures combined, the hip arthroscopy and the Ganz osteotomy as well. So there is some blood loss, but only about 5% of our patients require transfusions. It's pretty unusual for someone to require a transfusion. There's also a risk anytime you have surgery of infection. We give antibiotics before, during, and after the surgery to help prevent infection, but the risk is still there. It's about 0.5%, so it's a pretty small risk. It's something that we watch for and try to prevent. There's also a small risk of blood clots. Again, in our younger population, it's pretty unusual for that to happen. We typically will put patients on aspirin for a couple of weeks just to help prevent blood clot formation in the legs, and it's something that we watch for after the surgery as well. There are anesthesia risks. However, with a young, healthy person, the statistical risk of driving to the hospital is actually higher than the anesthesia risk. So again, the risk is not zero, but it's pretty small for someone who is otherwise young and healthy. There is a small risk that the bones won't heal. When we do this operation, we're creating a controlled break, you can think of it like that, and the bones do have to heal. Again, most of our patients are young and healthy, and so the risk of that, of the bones not healing, is pretty small, about 1%. There's also a risk of damaging nerves and blood vessels whenever you have surgery. It's pretty uncommon for that to happen. It is really common with this procedure for people to have a little numb patch in their skin on the outer part of their hip, and that's usually temporary, but you can have sometimes a permanent small numb patch there as well. It doesn't tend to affect your muscle strength or function, but just kind of makes the skin numb on the outer part of the hip. But I encourage patients, they'll often come in with their family members, bring a couple of people that they trust, and a list of questions with them to the office, and we do our best to answer all their questions in the office. Patients that we do this procedure for can come back and see us as many times as they like beforehand to get their questions answered and make sure that they're comfortable and know what to expect with the surgery. It is a big procedure to go through. It shouldn't be underestimated by any means. The first few weeks especially of healing are the most difficult. However, once they get through that, their hip joint is normal shape, their mechanics are good, their labrum tear is fixed, and they get back into their athletics, they're ecstatic. They got their lives back. Young people want to be young people and have fun and play sports and not have to worry about their hips, and this operation does that for them.